Hello there! Hello nurses and hello world! This is Nurse Cecile and welcome back to my channel! Video is solely for demonstration purposes only, as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden 10th edition. All information presented are public domain materials accessible to the relevant governing organization's websites. Subtle similitude may be noticeable. However, this is not intended to be definitive guide to the NMC Part 2 test of competence or the Osce examination. This can be helpful materials for overseas nurses or internationally educated nurses to learn and adapt to the UK clinical setting and transition effectively into practice. And welcome to another evidence-based practice video, okay? And so today, we are going to discuss about female myocardial infarction, or MI. But before we get into it, please give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more Osce videos, then hit the notification bell. If you want to ask me some question, please hit the join button and become a member so your question will be popped up to the top and I'll be able to answer your question as soon as I can. As soon as I can, because life is busy at the moment, okay? But anyway, let's discuss female myocardial infarction. So before we get into it, let's start with some introduction with what is myocardial infarction. What's the research is going to be all about. A heart attack or myocardial infarction or MI is a serious medical emergency in which the supply of the blood to the heart is suddenly blocked. And this is usually by a blood clot. Myocardial infarction or MI is commonly known as a heart attack. It occurs when blood flow decreases or stops in one of the coronary arteries of the heart, causing infarction or tissue death. Symptoms of heart attacks in women. Sweating, similar to sweat rather than sweating from exercise. Shortness of breathing or typically trouble breathing for no clear reason. Nausea. Flu-like symptoms including nausea may occur a few days before a heart attack. Pain in the arms, back, neck, or jaw. Pain can be gradual or sudden. Stomach pain can range in intensity from heartburn-like pain to severe abdominal pressure. Chest pain or discomfort. The pain can be anywhere in the chest, not just the left side. Fatigue or extreme tiredness. Myocardial infarction may cause heart failure, an irregular heartbeat, cardiogenic shock or cardiac arrest. Cardiovascular disease is the #1 killer of females in the United States today, and myocardial infarction or MI plays a role in many of these deaths. According to the Office for National Statistics, the deaths registered in England and Wales 2022, and this was released on the 15th of December 2023. Second to dementia, the second most common cause of death was ischemic heart disease, accounting for 10.3%, which is 59,356 deaths of all deaths registered in 2022. On the other hand, the leading cause of death for males was ischemic heart disease, 38,730 deaths, accounting for 13.3% of all male deaths. Myocardial infarction is a medical emergency. Call 999 immediately if someone might be having a heart attack, and the faster we act, the better their chances. So when you're about to write your evidence-based practice, because you will, it's a definite that you will take one evidence-based practice. So out of this, so many evidence-based practice plus this professional values, how are you going to memorize all this? That's why you're watching this video. I am here to show you how to write an evidence-based practice when it comes to female myocardial infarction. Again, evidence-based practice is a silent or a writing station in which you're going to be given 10 minutes for you to write in silence. And you're going to be given a lengthy research that you have to read, which will revolve around this kind of scenario in which you're going to have a patient with a chest pain suspecting a heart attack. But myocardial infarction diagnosis is ruled out, okay? So your patient now is asking you, because she's very worried about her condition, she's now asking you what she should do if she again experienced this same situation. So again, your answer should be based in accordance to the marking criteria. That's why you have to write this station. It's as if that you are talking to your patient, okay? So your patient is having this kind of scenario. Now, how are you gonna write your answer? Don't worry, you don't need to think too much because you're going to be given the research. That's what the research is for. This is an evidence-based, proven, okay? So this research will help you what to say to your patient, asking you what she should do if in case this sort of like heart attack happens again, or these symptoms of chest pain happens again to her. But of course, we all have to remember the marking criteria. This marking criteria is from the NMC right over here. And we all know, nurses, I keep saying this, marking criteria is the Bible for passing your Osce exam, so you really have to learn them by heart. With this marking criteria, I'm gonna help you break it down into a more memorable keywords for you to bring on your exam. So you are already ready, so you are equipped with the bullets that you're gonna be using during a battle. Are you ready, nurses? Yes? Okay, let's start, shall we? First things first, let me flash again the scenario, which is right here. And the marking criteria, which is right here. So let's start highlighting the keywords. Let's start with the first one. So which word do we have to highlight in here? Yes, definitely early and correct recognition. Because according to the marking criteria and according to the research, that early and correct recognition of the symptoms is vital when it comes to seeking medical help. Okay? So remember those words. Let's come now to the next one. Yes, she may or may not experience chest pain. That is true. Because according to the research again, nurses, according to this article, it's possible to have a heart attack without chest pain for women. Now for the next marking criteria. Remember the word symptoms. But of course, you have to write the symptoms, okay? You have to make sure that you complete your sentence, including the symptoms. But the symptoms alone can help you remember, oh, I know what to write in this bullet point. So, just a side note, nurses, what are those symptoms? Let's see. So, the patient may experience nausea, plus back, shoulder, throat or neck, cheek or teeth, and arm pain. So, those are the pain that patient may feel or may experience. So make sure you advise your patient to report those symptoms. That's why I want you to remember the word symptoms. How about the next one? Yes, cardiac related or not? So that's the question, okay? So you can highlight those words and it will remind you, okay, when you get to your exam, when you read the scenario, oh yeah, this is what I need to write. That she needs to emphasize the importance of reporting the symptoms, whether if she considered it cardiac related or not. So those are the things that you need to write. Cardiac related or not. Now for the last one. Yes, just the number. Call 999. This is why, nurses, you have to encourage or to advise your patient to call 999 in case your patient experienced these symptoms, because it's an emergency. Okay? Yeah? Okay. And I think that's it. We have discussed, we have break down the words, we have break down this marking criteria into keywords. We've highlighted them keywords to make sure these keywords will help us remember the correct answer when we are about to write our Osce exam, which is female myocardial infarction, an evidence-based practice. So, this is now the segment in which I want you nurses to write your answer. We've learned how to highlight them words, and now I want you to write your answers. I'm gonna give you 10 minutes. Yeah? And pause the video and just come back after you have written your answer. Time yourself, by the way. It's a good thing to practice yourself by writing and timing yourself at the same time. Time starts now. Oh, you're already back? Okay, so have you written your answers? Yeah? Let's check, okay? So I'm gonna show you my answers. Again, just a disclaimer, this is just my own opinion. I'm not saying they are correct. I'm just saying that they are just based from my own research. You are entitled to your own answers and you need to do your own research, okay? Again, this is just from my own opinion. Before we get into it, please give this video a like and support my channel by subscribing. Also, if you want to get notified just in case I post more Osce videos, then hit the notification bell. And comment down below what other Osce videos you want me to do next. Ready for my answers? Enjoy! Remember this, candidate, you have to summarize the main findings from the article summary. You also need to draw conclusions, make recommendations for practice, and you have to write clearly and legibly. I would tell the patient that early and correct recognition of myocardial infarction symptoms is vital in order to seek for medical care promptly for better outcome. I will inform the patient that, as female, according to the research, she may or may not experience pain in the chest. I will tell the patient that she may experience symptoms such as nausea and back, shoulder, throat or neck, cheek or teeth pain. I will highlight to the patient the importance of reporting any symptoms, whether she considers them to be cardiac related or not. If the patient experiences any of the symptoms mentioned, I will encourage her to call 999 immediately. Thank you for watching and I hope you learned something for today. This has been Nurse Osce. See you on the next one. Bye! Now we have come down to our shout out section. I would like to congratulate our candidate who just passed their exam at J. Thomas 5321. Same goes to at Maverick FP40I. Congratulations. Also for at Salini Rajan 575. Congratulations. I'd like to welcome to the team at Kaiming Lai 383. Also, shout out to Mary Lou 4710. Same goes to Chamirema Judith. Welcome to the team. And likewise to Benedict Peñaflor. Hello, everybody.